we're going to talk about anchoring and traction devices for the Minnesota tube. So once placement has been confirmed, you want to make sure that the provider has blown up the gastric balloon to 400 to 500 cc's of air, and then you will apply gentle traction to make sure that you are tamponading the GE junction. That is the main way that you're stopping the esophageal bleeding from happening. If needed, the esophageal balloon can also be blown up. That is based on how much bleeding you're seeing coming out of the aspiration port. The highest amount that you would blow the balloon up to would be 45 millimeters of mercury, but it's really based on the patient's bleeding and what the provider feels is necessary. So to apply traction, there's a few different ways to anchor this device. First one is the helmet. You would put the helmet on the patient, and you're constantly checking skin integrity when you've got this on the patient. And then kind of threading this through the face mask here. You would apply gentle traction, and then you would anchor onto the face mask with a zip tie to make sure it stays in place. And then that would be one way that you could keep it from going anywhere. If for some reason the helmet doesn't fit, or there's some sort of head trauma, there's some reason that you can't use the football helmet, you can also use a C-collar. You would apply the full C-collar to the patient, and then again, applying gentle traction and using a zip tie to anchor there. This is not used for C-spine immobilization in this case. It is only being used to make sure that the patient has the proper traction and anchoring, and that the tube doesn't go anywhere. And finally, you can also use this counterbalance. You would attach whatever you can, whatever, I'm just using acrylics right here, but whatever you need to attach a bag of fluid to the tube, and then you would use this as a counterbalance over an IV pole or the pole that's attached to the bed. You either use 500 cc's or a liter bag, and that represents 1 to 2 pounds of traction, which is the recommended amount of traction for the Minnesota tube. Once you have everything secured and anchored and traction in place, you want to make sure that you're setting up the suction to the 2 aspiration ports. That is where you're going to kind of watch for that continual bleeding and assess how that patient is doing as far as the output that they're having. Patency is going to be really important with this, so you're going to make sure that you are lavaging as needed. If you see nothing coming out, especially at first, it's very unlikely that that is the case because these patients bleed so much. So you're going to want to use your irrigation set, lavage, keeping track of how much fluid you're using to lavage, and then setting the suction ports back up to, or the aspiration ports back up to suction, and keeping track of that in your eyes and nose.